As we approach Memorial Day weekend, the Obama administration is embroiled in a scandal that threatens the lives of the very men and women who protect our way of life. Our vets are dying while sitting on waiting lists, and it's disgraceful, but it gets worse and much worse. I spoke to former Pentagon spokesman J.D. Gordon on Hannity last night. Listen. He explained how Gitmo terrorists are getting better health care than our heroes. Listen now.
Guantanamo, there's about 150 detainees there right now, and they've got a medical unit of about 100 doctors, nurses, and health care support staff. 1.5 to 1 is the ratio. There are 21 million veterans, and of those 21 million veterans in the United States, 9 million are receiving VA care. But if you look at the VA employees, it's 267,000. That's a 35 to 1 ratio. So I think that President Obama has a flawed sense of priorities. He's taking better care of al-Qaeda detainees at Guantanamo than our own veterans.
And Gordon should know he's visited Gitmo more than 30 times, and he went on. How would you rate the Gitmo detainees, the health care that they receive? A is the best, F is a fail.
It's an A. A plus even. I was down there so many times in the medical facility. The detainees don't have any kind of waiting list. They get seen on the same day. It's a shame that our veterans are not getting that same level of care.
Well, enough to make your blood boil. Terrorists getting better treatment than our vets. Only KG in Obama's twisted priority world would something like this happen.
Can I tell you, I feel like almost the outrage coming out of me and filling me with sadness. Is this possible? It is really sad. Do you know what the veterans would do to even receive 1/10 of the quality of medical and health care that the Gitmo detainees? It's because we're so paralyzed with fear about doing the right thing, about offending anybody in the Muslim community or any of the terrorists, that we're sitting there bending over backwards to do better for them than our law-abiding citizens who have served and given their lives and made sacrifices to be away from their families to be able to protect our country and keep us safe. I mean, if there isn't something more wrong than that, I don't know what is.
I have to agree.
Kimberly, I can't believe how Islamophobic you are. These Gitmo prisoners should be treated better. They're misunderstood holy men outside of their own country. They're all just victims. Meanwhile, our troops,
they're lonely.
Our troops go out and kill people, but they're just victims of an evil Western state. I'm saying this because this will be the next trick by the media government complex. They were going to portray outrage as partisan and likely racist. By Tuesday, after the holiday, the Obama scandal condom will be up and running. Just like it was with the IRS, the DOJ.
Condom? Is that what you said?
The scandal condom is what I call it. Okay. Just like they did with the IRS, the DOJ, the ATF, and the rest of the alphabet. It comes up, and then it's impenetrable, and there's nothing you can do about it.
Okay.
Thanks for straightening me out.
J.D. points out that the ratio is 1.5 to 1 per Gitmo prisoner, and then these poor vets, literally thousands to 1, hundreds and thousands to 1, just to get basic services.
Yes, and not even just basic services at Gitmo, because they're waiting for their 72 virgins. Don't we supply them with access to pornography? They have a new soccer field funded by the taxpayer so they can practice their soccer skills. They have it really well. In fact, I think most Americans have it better than our veterans. Another issue, as immigration starts to creep into Washington, D.C., you're going to hear people start to get outraged about the fact that illegal aliens, people who've broken the law now, get better treatment than our veterans. So it seems like this administration is comfortable with everybody getting the best treatment, or better treatment, I should say, except for our veterans. And you know what, Eric, this was proved yesterday. A bill passed the House that would allow the VA to easily fire people, to clean house if he wanted to. Passed right through the House of Representatives, blocked in the Senate by Bernie Sanders. He blocked it, and he's the one who, when was told about this VA scandal that people were dying, he goes, people die every day. That's their attitude about this. Who cares?
Bob, you've been very good. We're 4 minutes and 27 seconds into the show.
He's taking a nap.
It's so ludicrous that it's hard for me to. I'm still getting over the condom analogy, but that interview you did with that guy.
Condom.
Huh?
Scandal condom.
Scandal condom, as opposed to a big condom. Okay. I see.
No. Meaning
he's avoiding the issue.
No, I'm not avoiding the issue at all, because it doesn't make any sense for this guy to compare Guantanamo with the Veterans Administration. First of all, it's not just the prisoners down there. Guantanamo is a military base. It covers everybody on that base, so there's a lot more people down there than the 30s, whatever they said there were in terms of prisoners. And the other thing is, it's not that Obama is personally thinking it's better to take care of these. Do you really believe that? Do you believe that this guy wakes up at night and says, you know, let me think. I think I'm going to treat the Guantanamo prisoners better medically than I'm going to do our veterans.
I think
That's a good idea.
But, Bob, I think he does. He's always worried about the perception that he would be seen as intolerant of a different culture. And I think that informs his decisions. So maybe this is what you call an unintended consequence of a PC administration.
And the point being, a Gitmo prisoner has anything. They got a problem. They got a toothache. They break a thumb. They get seen immediately. Our veterans may
true about federal prisons.
All right, well, okay, let's do this.
That's true.
Oliver North, a war hero and host of War Stories on FNC, says being treated at the VA almost killed him.
Had it not been for the Fox medical plan, I might be dead right now. When I was diagnosed with cancer caused by Agent Orange, and the VA recognizes that, the VA told me to come back in about 6 months. My wife thoughtfully said, let's get another opinion. A biopsy was done, and urgency was given to the treatment of the cancer. And I'm alive today to tell you, if I hadn't had the Fox medical plan, I might not be here.
So let me guess, Bobby, an isolated?
I would say it's not only isolated, but I also would say that the idea that somehow in the VA, Ollie went in there and they did a diagnosis and they said, come back in 6 months because we know you're going to get worse in 6 months. You're probably going to die. Are you kidding me? I mean, how long are we going to go on this thing? We're picking out the most extreme stories. It's easy to do.
But you're saying that what he says is untrue.
No, I'm saying that I'm glad he got a second opinion. I like Oliver North a lot, but the idea that somehow this is the rule rather than the exception is just ridiculous.
Well, that's okay. The VA being a mess is not news.
Right.
We know this. The news is the list, which was an attempt to pad and bolster careers and bonuses that led to the 40 deaths, which returns to the simple question, which I think, Bob, you understand, who pushed the list?
I think that's the fundamental
that needs
question.
to be on a T-shirt, and people need to wear it. Who pushed the list?
We act like lists are so scandalous.
Exactly.
When lists are just a part of government-run healthcare. That's why I don't think this is a scandal. I've said this over and over. This is just government-run healthcare, and this is why I actually think, Greg, that maybe this scandal condom is thinner than the others and will break, because this undermines President Obama on his signature issue, and that is health care. He's told us for the first how many years of his presidency that government-run health care, or government, I know Bob's ready to jump, government intervening in health care like Obamacare is the answer. And it's falling flat on its face.
So I was just scared about the thought of a breaking condom.
All right.
So, KG. All right.
Bob is trying to dance around here, a little razzle-dazzle, to avoid the main issue, because you can't dismiss the problems at the VA. You can't dismiss testimonials like from Colonel North, because this is what's happening, and it's affecting military across the board.
Stay on this for 1 second right here. So lists, right? Greg and Andrea point out lists. Oliver North. Are we not talking about rationing health care?
Yeah, I mean,
of course we are, right?
The only thing is they didn't put a war hero at the top of the list. I mean, is that the only positive thing you can say about the VA? They even treat him like everybody else and put him at the bottom of a wait list. I mean, this is sad.
You think other people don't get bad diagnosis?
Of course they do. My point is they should all be treated with proper medical care and attention, with a sense of urgency.
You know, my belief is when Oliver North went to the VA, it was a sense of urgency. They did the best they could, and they came back with a diagnosis that was
That's the best that they can do. Someone who's a veteran who goes to a VA hospital doesn't have the option to get second and third and fourth opinions. They have to go to the VA-sanctioned doctors. They have VA-sanctioned drugs, VA waiting lists. It's much like the Medicaid system. And when you bring in the Independent Payment Advisory Board, IPAB, in Medicare, you're going to have even more rationing. That is why Obamacare is going to end up much like the VA system,
and by the
especially
way,
with all the people signing up for Medicaid.
And if they have their way and you have your way at some point down the road, single payer system, big old VA.
I'd love a single-payer system, but by the way, I was told up here I can't mention a certain word we've been talking about, so I won't do it.
All right.
But
go ahead.
I didn't get my point out.
But we don't want to talk about those things anymore.
Well, I didn't. Andrea raised it, not me.
Greg brought it up.
Oh, Greg did. That's right.
All right, well, let's do this. Let's move on.
That's what I'm here for.
She's yelling at me in my ear. You hear this?
Were they telling you not to say condom anymore?
That's what I was being told.
They didn't tell you not to say.
No, they didn't tell me. But
see, now that is so unfair. The guy-
Great. I got it under the radar.
Unbelievable.
That's right. And I have to take the hit for it.
Take a listen to the man at the center of the VA scandal. Late yesterday, General Eric Shinseki released a message to the veterans saying, in part, quote, I take any allegations about patient safety or employee misconduct very seriously. If any allegations under review are substantiated, we will act. As we approach our observance of Memorial Day and its special significance to our nation, VA is redoubling its efforts with integrity and compassion to earn your trust. What does redoubling its effort mean?
I was going to say, what does that
Twice
mean?
as bad as they've
Twice
been.
as bad.
What does that
Ooh,
mean?
great.
Investing? I have a feeling they're going to invest more money.
It means they only worked half as hard before. So now you can double it, and now you're doing just about the bare
Does
minimum.
that mean half the deaths?
And take double our money to do even less with it. This is what's so sad. I mean, that's just like a little emotional platitudes that don't mean anything.
Whoever
They need
came
to,
up
like,
with the
clean
policy,
house.
whoever came up with the policy to award people for having the most visits, on-time visits.
Yeah, that's
and
the
there
thing.
you got it. You get a bonus, and you get whatever else you get. That was a stupid decision
Who
because
pushed
it
the
leads
list?
itself to exactly this kind of situation. There should be no more bonuses or for performance in a veterans hospital or any hospital.
But think about, Shinseki, if you look in the back of all these problems and scandals from Rice and Sebelius and Hillary, no matter how bad anybody is, they're never forced to leave. And I realize it's because of all of these academics that come from a college teacher's lounge.
Oh, here
this
we
is
go.
the first tenured administration. They believe they have tenure, that there's nothing they can do to get fired.
Now, Bob,
right.
Okay, so your point. Whoever pushed this idea of lists and making sure that you get
yes.
bonuses for short waiting lists or no waiting lists.
Yeah.
CBS has an email from one of the administrators, I believe, of the VA hospital, telling people, it may have been a different one. I'm not sure which one. Of a high-level administrator telling his people, don't put anyone's name on the list to make the list look shorter.
That person should be fired.
Okay. All right. Good idea. Let's start there.
One of many.
All right, next.